Hi, everyone, and welcome to the Opening Up Data to Drive Gender Pay Equity in the Care Economy panel at ModeFest. This is my first ModeFest panel, so I'm really excited to be part of this great community today. My name is Mercedes de los Santos. I'm a project manager at Open Data Charter. We are a global organization working to promote our 6 open data principles into public policies to ensure governments collect, share, and use well-governed data to respond to pressing challenges. As the title suggests, these sessions is focused on strategies and experiences held by international organizations such as the Center for Global Development and Open Data Watch, and Buenos Aires City government in promoting gender equality through open data. To make an introduction to the sessions, I will present our topic. So the pandemic has brought to light in an unprecedented way the importance of care work for the sustainability of life and the unequal distribution of work among men and women across households, public services, the private sector, and community organizations. Surveys conducted since the start of the pandemic had confirmed that women have suffered the greatest increases of caregiving. So more quality data is needed to provide a gender perspective on who has received the biggest impacts, which requires support, and what kind of support social system needs to provide. So government policies and programs require quality data to calculate possible care needs and intervention that reduce inequality gaps. One of the clearest ways in which barriers to women's economic and social autonomy are made visible is through their disproportionate share of the formal and informal care economy. Revealing such disparities through data, particularly in household setting and the informal economy, is crucial to government that wish to address gender pay equity. From a policy view, it's clear that we require new plans to deal with the care crisis exacerbated by the COVID-19 pandemic. In this scenario, presenting example of data policies that help make problems visible and offer effective solutions of care supply and demand, it's an important step to closing gender pay gaps. So this panel will showcase the care indicator system as a collaborative project, between the Open Data Charter and the government of City of Buenos Aires, as well as the insight of our guests in their work with data and its intersection with gender and care economy. We hope to present the latest discussions on how the production and generation of care data can be incorporated into the public agenda through policies that seek to transform gender relations. So, as I mentioned, this session is focused on sharing some thoughts and experiences around this topic and discuss with all of you what promising solutions we can identify to address these challenges and try to tackle it so shared, trustworthy, and open data. So to begin with that, I have in this panel a wonderful woman to explain about this problem that we are facing now, in the past, and probably in the future. I would like to start the discussion with Sheila, who will introduce us to the current state of open gender data around the world and why it is important for equal pay. She will discuss the broad data ecosystem in which open data on equal pay exists and the actions needed to overcome the challenges that hold us from making the most impact. Welcome, Sheila. Sheila is a managing director of Open Data Watch, an NGO focusing on monitoring and promoting open data in national statistical offices. She has been an active member on the UN Secretary General's Advisory Group on Data Revolution, co-chairs the Sustainable Development Solution Network, Data Network, and has played a key role with the startup of the Global Partnership for Sustainable Development. As a senior advisor, Sheila works closely with the Data 2X, focus on knowledge creation and advocacy for closing gender data gaps. So Jada, could you tell us a bit more about your emergency findings and key promising actions to the open gender data? How can open data be a catalyst to drive gender pay equity in the care economy? Shada, the floor is yours. We are looking well your presentation.
Thank you. And thanks, Mercedes, and thanks to Open Data Charter for organizing this event. And really delighted to be part of the RightsCon and also this session in particular. So we are here today to discuss how we can harness open data to drive gender pay equity and overall, in fact, gender equality. I think gender pay and attention to the care economy is really a great sort of leading indicator for us to understand gender equality. So it's really an important topic, tremendously critical issue facing our world right now in crisis. Many of these issues actually get even worse during the crisis. And it's really an important issue for whoever, well, wherever we are, not only session organizers, panelists, and many, I'm sure, audience that are listening to us today. In fact, equal pay is enshrined in the Sustainable Development Goals under SDG 8. So this means that, for me, it means that 193 countries, member countries, endorsed the 2015, the SDG agenda, and in fact, really committed themselves, this leader of our governments, to achieving equal pay is really a priority activity and a critical element that should really guide our discussions and work going forward. And within that 8.5, there's a very important indicator, which is monitoring the earnings of employees by age, sex, occupation, and persons with disabilities. So this is a very important, 8.5 is a very important target and goal for us to monitor, and the indicators underneath that. But while this acknowledgement at the international level is critical, what is really measured gets managed, as we all say, and we need to have access to high quality and open data to understand the status quo, identify our blind spots and critical countries or areas for action, and actually monitor our progress. My presentation today will walk us through the state of open data, particularly focused on gender data, and why openness is such a critical factor as a catalyst for impact and change. I see many of you are converters in this in open data, so I really don't have to work that hard. But for gender data, it's tremendously important as a sort of creating an enabling environment for us to be able to use data for this care economy, for this gender equality and gender pay. And I hope this broader context would allow us to set the scene for a more in-depth discussion. So, but before going ahead, I just wanted to quickly, again, I know many of you are open data experts, so excuse me, but this is the definition that we're using for open data, that data needs to be made open in terms of legally, in terms of the license, in terms of accessibility. It should be machine readable, and it should not have barriers for taking the data and using it further. So it should be really non-proprietary. So why are these four conditions, and why is this so important? But I'm using the data value chain to particularly show the importance that's attached for us to think of open data and think of all the different stages of how we use data to drive change and have an impact. Many investments that we make in data collection actually get stuck by data not getting published, or sometimes data gets published, but in PDF format or in non-accessible format. So what we are really advocating is the data value chain should be really used to drive the data from collection to publication to uptake and to impact, to maximize the value of the investment that we have in data. And open data is really one layer, important layer for making this to happen, for data to go from collection to impact and bringing about change. But despite a lot of the work that has been done on opening data and the value of data, we still have some way to go. My group, one of the things we're doing is we watch actually the state of open data, official data, such as the indicators of SDGs in 197 and 194 countries, in fact. And this map, summarizing it is very elaborate, but this map basically shows the latest round of what we have done called Open Data Inventory, ODIN assessment. And the color, you will see that there's still a lot of improvements needed in the world. Dark red means that the countries are not in the state that they should be. And then going to yellow and to orange, yellow, and green, and darker green, you'll see some improvements. We've been monitoring this data for many years now, and we see quite a lot of improvements in many countries. So, countries are putting more emphasis on importance of data and investing in data availability and data openness. So that's really good news. Another good news is you don't really have to be a rich country to be able to make your data available and used, and including the SDG data for 8.5. So there are many developing countries, in fact, that are doing quite well in making their data available and accessible. But another component of the open data inventory that we watch for is specifically looking at gender. And here what we're trying to show is that in many cases for ODIN evaluation that we do, we take some 20 so indicators across 8 categories and look at the sex disaggregation and their availability and openness of data, which are relevant for gender, for particularly consequences for women. And here we see that since 2016, the median score on the ODIN gender index has risen by 21%. But at the same time, you see that the score on the remaining non-gender related categories, for example, in the economic, financial statistics, they're rising much faster by 40%. One of the reasons for this is that this data, more of the economic and financial data, have been in very high demand for many years by politicians, by decision makers. So the data producers and data investors have had a better chance because of the high demand to produce this data and make it accessible. And the point is, and I hope one of the points that will come out from our discussion is how can we create a bigger demand for this data, for the care data, and for equal pay data, so that there would be more motivation and more investments to create this information for us. But bottom line is clearly there's still work to be done to ensure that gender data and open and accessible at national and subnational level, and also at the micro level, at the household and individual level, becomes much more easily produced, up to date, and accessible. If you look at the SDG global database right now, you will see this data, but often they're late. The latest data, for example, for the 95 countries is between 2016 and 2019. So accessibility is not only important for, is also important for actually bringing more timely data to bear. So how do we go? Usually, this is my kind of way of doing things, or my group, is that we look very deep in the gaps in data. We look at where the gaps are, the causes of data, but we're always looking ahead and quite optimistic as how we can, what are the ways that we could improve the status quo. So here I have four actions recommending for the path forward for open data for gender equality. One is that we really need to continue to monitor and maybe targeting very well, monitoring the openness of equal pay data and this SDG indicators, and highlight the progress. Not always sort of focus on the bad news, but really highlight those areas where, and those regions and those countries that are making a breakthrough. The second thing is to advocate for more national gender pay transparency regulation, and of course, international standards. Both international standards for production of this data, for reporting of this data, for actually making sure that this data come with metadata and they are used and they actually make a difference. The third one is very important because most of what we're talking about is public sector data, the data that's being collected by public sector and is making it accessible. So forging public-private partnership, particularly for this topic, is tremendously important to support the opening of private sector data alongside, so that we can actually make sure that there is equity in that as well. Equity in access to data, but also equity in the pay. And then finally, documentation and communication cases of use and impact to show the value of the open data on equal pay. We try to make a lot of the stories and a lot of the values, to document some of the values that we get from impact of data. And I think this topic is tremendously important, and we would be very interested to take that on and do further work and advocacy. And the Open Data Charter is doing a great job in that area. And I'm really interested also to hear from Megan, because she's doing an amazing job there. I'm sure she's going to talk about care, cash, and data, my three favorite words these days. The last thing I wanted to say is that what we are trying to change, the change that we're trying to make in this data ecosystem and the impact of data is, right now, most of the time we are caught into what I call a vicious cycle, where the poor quality of data, poor investment data and capacity just kind of drives itself from one stage to another. And with the open data, and particularly with focus on some of the thematic areas like today on the pay and care, equal pay and care, we are hoping that we would be able to really increase the demand for data, and as a result, create a virtuous cycle of better resources, better capacity, and better governance for data. So here was my presentation. I didn't time myself, but I don't think I went over time. But really, thank you again for this opportunity. I'm really looking forward to the discussions and answering any questions you may have. Thank you, Mercedes. Over to you.
Thank you, Sheila. It was an excellent presentation. I think that it was a lot of information and a lot of things to think, particularly in the open data community, and how to communicate open data community with gender community. I think that one of the things that you mentioned is lack of transparency and inconsistency, in the information available inhibits the understanding of gender inequalities, cause and effect, and slows progress in promoting gender equalities in the workplace. So I think it's too important to continue monitoring and targeting the openness of the equal pay data. So thank you so much, Sheila. Probably later I want to know more about the challenges in publishing gender disaggregated data, because I think it's too important. But now I will want to give the floor to Megan O'Donnell. She works on issues related to women's economic empowerment and financial inclusion, gender data and measurement, and development effectiveness at the Center of Global Development. Actually, she has working on gender impact of COVID with increased unpaid care work, driving much as gender gap in lost employment, income, and business closures. Megan is a policy fellow and assistant director for gender at Center for Global Development. She has a master's degree in Middle Eastern Studies from the University of Oxford and a bachelor's degree in politics and French from the University of Virginia. Megan, could you share with us what CCDs, what you work and how you work, and help us bridge the care inequality. The floor is yours.
Thank you so much, Mercedes, for that kind introduction and for inviting me to join these wonderful panelists today. And thanks to Shada, who I always learn from, and whose leadership at ODW has really sort of pushed the agenda forward at the intersection of open data and gender equality. I am going to seek to complement what Shada presented in the next few minutes by explaining the work that we've done over the past couple of years under an initiative that I've directed called the COVID-19 Gender and Development Initiative, and then dive deepest into kind of donor financing for care. What data we have available, what we've been able to pull together, though it has been a bit of a challenge, and where we still have data gaps, and we need to be able to fill those in order to make progress in this sector going forward. So Mercedes, you started in your introduction, and Shada sort of agreed with the point that obviously COVID has magnified some of the challenges that we've seen, the gender gaps in who performs unpaid care work within the household, who also is paid but paid poorly to do that care work, outside the household. And my colleagues Charles Kenny and George Yang about a year ago pulled together data on pre-COVID rates of who was doing childcare unpaid in the households. And then we're able to devise a model projecting what had happened during COVID due to school closures, preschool closures, other quarantine measures that meant that disproportionately mothers and women as caregivers were needing to step out of the labor force to care for children who were not able to go to school. And the results were pretty dramatic. So we see in their calculations that women have performed an additional 173 hours of unpaid childcare. That's just childcare, so not taking into account other sort of care and domestic work. In contrast to men's uptick, which was at 59 hours. And to put that into context, 173 hours sounds like a lot, but it's equivalent to 22 days of full work, or almost a full month's worth of work minus the weekends. When we look as well at this intersection, Mercedes, that you've sort of flagged in bringing us all together around the care economy and pay, we also have recent work done under the initiative in partnership with ODI that looks at the intersection of care for older persons and migrant workers. And I'm happy to pop all of these reports and links into the chat after I stop speaking with you. And it is not surprising, but we confirm the intuition that these are the folks, oftentimes because they are the most marginalized. They are working within households, they are working informally, they have migrated oftentimes from low income to higher income settings where they don't have networks, access to information, the language skills, are not empowered and equipped to be able to advocate for labor protections and proper working conditions. All of that is a perfect storm for poor pay and poor working conditions. And so it's no surprise that even though we still have improvements to make as it relates to pay data within this sector, we're going to need to figure out a strategy to improve the broader kind of working environment, including pay, given that these are disproportionately jobs that women are holding. Okay, so with that all as sort of the problem and the context behind the scenes, the other thing that we sought to do under the COVID Gender and Development Initiative, and this is where Shada just said the words cash, care, and data, was to propose policy solutions to promote not just an inclusive recovery from the crisis, but also longer-term gender equality. And when it came to care and really the intersection of care and data, we wanted to seek to provide a baseline figure of the extent to which care had been financed and supported by international financial institutions, by bilateral donor agencies, and to some extent by national governments, although as I'll touch on in a moment, there's been great work done by our partner organizations at the national level. So we focused on the IFIs and the donors that are really CGD's sweet spot to complement those who were looking at national level policies. So the first thing we did was to go back in history 20 years. So we started at the year 2000, all the way up to 2021 when we published this paper. And we looked at 8 multilateral development banks. So this was the World Bank, the Inter-American Development Bank, African Development Bank, etc. They're peer institutions across regions. And we were able to pull together data on every childcare project that they had financed over that 20-year period. And I will say encouragingly that there were quite a number of projects. There were quite a number of interesting designs and innovations that we can certainly learn from and hope to scale and replicate over time. But the overall financing figure was pretty dismal. And it may not be a surprise to this group, but to put it into context, over that 20+ year period, we found $2 billion total going into these sorts of projects. I should say that that's not just dedicated financing specific to childcare, but that's projects with a financing component related to childcare. And $2 billion might sound like a lot in isolation, but when you put it in context, we also know that just in 2021 alone, $2.2 billion went to oil and gas projects. And it pales in comparison to other sectors as well, right? Whether we're thinking about healthcare, whether we're thinking about primary and secondary education, or other forms of sort of hard infrastructure, childcare and broader care has just never been prioritized by the donor community. It has not been a traditional area of focus. We see this trend play out on the bilateral side as well. We put out a piece that, again, I can share the link to, that examined G7 countries. And the most recent data we had was from the OECD DAC that you all may be familiar with, looking at G7 countries' investments in early childhood education, finding that that constituted just 0.07% of ODA. So not even 0.1% of ODA. Now, I will say this is also where we run into a gender data gap and an issue that we'll need to solve going forward, because as you all know well, early childhood education is not synonymous with childcare, and it's not synonymous with the broader care economy. So one of the things we would absolutely love to see improved upon going forward, especially as we're looking at these donor institutions, is the ability to code for care in that data so that we have sort of a clearer understanding of what is being financed and what results it's having going forward. As I mentioned, on the government side, there are fantastic resources by partner institutions, including Women, Business, and the Law, sitting at the World Bank, whose most recent report put out a first ever chapter on childcare laws and policies across 93 economies, as well as UNDP and UN Women, which put out a COVID response tracker, which includes COVID response related to care services. These are equally kind of dismal stats. The Women, Business, and the Law report showed that just 11 countries in their sample provide free care, and that just 34% provide any kind of subsidy or income support to low-income families. So quite a lot of improvement to be made there. On the UNDP and UN Women side, this categorization of all gender-sensitive COVID response measures by and large constituted cash transfers, which are obviously important and correspond to our cash care and data framework, and measures around gender-based violence, prevention and mitigation and support. Very, very few focused on care, in spite of how much we know COVID has impacted this dynamic. So we see this as a really missed opportunity. Mercedes, how am I doing on time?
No, it's okay.
Still
Let's
okay.
wrap up. Yeah, you have 1-2 minutes more. Yeah.
Okay, great.
No problem.
Huge missed opportunity because we have partners now who are working to synthesize data on the return on investment opportunity. So how are we going to make the case for the fact that this money should be invested in childcare and strengthening the broader care economy, as opposed to those oil and gas projects, for example? Well, one of the ways is to say that this is going to be good, not just for families, but for whole economies. And it's Frame, one of our partners that focuses on mobile phone surveys and generating data that way, that just put out a report pointing to the fact that if childcare provision were sort of meeting the need in Nigeria as an economy, for example, you'd see 9 million people, mostly women, re-enter the workforce. So an 8% increase in labor force participation. The Eurasia Group has done similar analysis at the global level, finding that the global gender pay gap, super relevant to today's conversation, would be reduced by 8.6%, and that would generate $527 billion in additional money towards GDP. So I'll just close by saying that obviously the case is being made and there's a lot of momentum building around this issue. We are encouraged to see, for example, the first ever IDA commitment coming out of the World Bank Group that focuses on childcare and supporting childcare provision in 15 low-income countries. The World Bank has also just launched a new childcare incentive fund that is meant to leverage IDA funds and encourage low-income countries to throw in their own money to start to improve the care economy in those countries. And actually today, just this morning, I joined a kickoff meeting for the Inter-American Development Bank's first community of practice focused on early childhood education, which obviously has intersections with the broader care agenda. We are optimistic about the fact that the G7, which is sitting in Germany as its presidency this year, will hopefully continue to build momentum in the right direction, as will the Global Alliance for Care, which was launched at last year's Generation Equality Forum. But it's clear that data is going to have to be a huge part of pushing forward in each of those different pathways. We're going to need the return on investment figures, not just for Nigeria and globally, but across national contexts and even sub-national contexts like Buenos Aires. So excited to hear from Marisa. We're going to need data on what works for whom, design and implementation features that need to be prioritized as these programs are designed. And we're going to need data continuing on that baseline of what is the existing financing and policy landscape and how can advocates and outside influencers be pushing for improvements over time. So thank you so much. I'll end there.
Thank you, Megan. I think that you bring up a very important topic about this, about that we are discussing, because we can publish a lot of information and a lot of data that's aggregate, but we have to think in the importance of the support in this kind of policies. In Open Data Charter, we promote the open by with a purpose, and the idea of that is try to publish information thinking in the impact. And for that, we need to think in this economy recovery that we are facing now in all of our countries, in trying to put money or support in the care policies too. I would like to discuss later before after Marisa about if you know or if you can explain more about this experience in which bilateral organizations are supporting some of these care policies. So, but after that, we get in the discussion. I would like to give the floor to our third panelist, Marisa Miodowski. She's a representative of Buenos Aires city government, and she is working, and she works a lot promoting gender equality through public-private partnership and data sharing in open format for public consultation. At the beginning of this year, I think, they launched the care indicator system that is really interesting and innovative initiative about how demand and support are distributed in the Buenos Aires city. So Marisa is a gender policy specialist from Argentina. She studied political science at the University of Buenos Aires and has a master's degree in sustainable international development from the Heller School for Social Policy in the United States. Since 2016, she works in the government of the city of Buenos Aires, where she coordinated the city gender equality strategy from 2018 to 2020. In 2021, she joined at the Buenos Aires Statistics Office, where she has coordinated several data production projects, including the care indicator system, that I think that it's the unique system at least in local government. So Marisa, could you share with us the work that Buenos Aires city government is leading to promote gender equality through data, and how you envision this care indicator system is helping you out with that? So the floor is yours, Marisa. Excited to hear you.
Okay. Well, good afternoon, everybody, and thank you so much for the opportunity of being here, for the opportunity to listen to Sheida and Megan. I have just learned a lot, and I'm eager to read the documents that you just mentioned because they are like music to my ears. We love data. We want to use data. We want to use all these lessons learned and the policy recommendations that international organizations give to governments. And I'm currently, as Mercedes said, sitting at the local government at the city of Buenos Aires, working mainly in a data producer office. I left my former role as using the data for policy making. I moved to another place, producing data and making this data available. But while doing that, we always try to see what the state of the world is doing, and all these documents and the recommendations that we are producing are really useful for us, not only to guide our work, but also to convince policymakers about the relevance of investing on all that. Because as you probably know, producing data is expensive. Mainly producing data from surveys or censuses is costly. Governments have to invest a lot of public resources that are worth investing to, but because they are later like the main research for policy making, but we have to make the case. So all this research and the work that we have mentioned is really important for us. And based on that, on all that, on the previous knowledge that in America,
I think, Marisa, you have some technical problems?
No.
Okay. Now I can hear you well. Sorry,
well,
go ahead.
I was saying that based on the knowledge developed by international organizations, but also by our local researchers, our local advocates using data, we have embarked last year in producing this care indicator system that I would like to share with you today. I would love to use the time guiding you through this system, sharing what we have done. And I would like to answer a couple of questions. First, what is the care indicator system about? What is its purpose? What type of information it does provide? Who is the audience that is using and reading and analyzing the data published in the system? And also how it could be improved. So I'm going to share my screen. Let me see, here it is, to show you, are you watching my screen now?
Yes, we can watch it perfectly.
Okay, so this is the first part of the care indicator system. And as you can see here, we first have a definition about what the system is about. And as Mercedes introduced it, the care indicator system is it shows how care is organized in the city of Buenos Aires. And the first thing that we do after explaining the objectives and the purpose of the system is to go. I'm sorry, this is in Spanish because our main audience is our colleagues inside the city government, and also researchers and academicians and advocates in the city of Buenos Aires, but we want this to be also a model for other parts of Latin America. But if donors believe on us, we will be translating in English soon. So the second part refers to the definition of care. Megan just mentioned that it was difficult for her to code the operations, the projects that the international community has invested in other parts of the world, because some did not qualify as care, some were related to education. So here we provide the definition about what care is for us in this system. And we pick the definition that was provided to us by one of the NGOs, one of the organizations from the civil society that help us in developing this system. And by care, we refer to all of these activities that allow the reproduction of people's daily lives through the provision, either of physical elements, but also from symbolic needs. And scrolling down, we have the main populations that receive care. On the one hand, children and adolescents. Secondly, on all people with dependence needs, not all people, but just those who are in need of some sort of support and care, and people with disability. And finally, scrolling even down, we have the actors that provide the care. On the one corner, households. Secondly, the state or the government, as it is called in the US, the private sector, and the community. All civil society organizations or community-based organizations that are, at least in the global south, very strong and very involved in providing care. Then we go to the data. I'm sorry if my internet is a little bit slow, but are you seeing the data now?
Yes, perfectly.
Good. So in the second screen, we have all the indicators organized around this. That is what we call the diamond of the care. And you see that we have the 4 vertices of all the actors that provide the care and inside the populations. I'm not going to click now in order to use wise the time, but I'm going to show you very fastly how many indicators and how they are organized. We see that the first part deals with what we call contextual indicators. These are the indicators that provide the audience an idea about the current and the potential demand of care. You see here that we have year 2024. So these are projections about how much population will be needing care by this year. And we have all the system organized by other 3 very significant variables that are the geographical location of the population. We have our city of Buenos Aires divided into 3 main zones: the northern part, the central part, and the southern part. And this is extremely significant for policy-making purposes, because you, as a policymaker or even as a researcher, with this information, you can see where this population resides, where do they live, and you can match on where the services are provided, and you can analyze where the main gaps remain. So basically, in the first part, as I mentioned, we have a lot of indicators, many indicators that describe the populations who are in need of care. And secondly, we have indicators about the supply, organized among the vertices of the pyramid: the government, the households, the private sector, and community-based organization. And as you can see fastly from my scrolling in the screen, we have a lot of indicators for the government part, for the state, but very few indicators, only 3 for community-based organization. And this is also providing some information on what my former colleagues were mentioning about the scarcity of data. Most of the data for the government, for the indicators that have to do with the public provision of care services, come from either administrative records that the city of Buenos Aires collects, or from surveys and censuses that we at the Statistics Bureau carry out. But in the case of community and civil society organizations, we have been struggling in gathering and collecting this data, because this data sometimes is not available and other times is not well registered, well collected, and with the rigorosity needed to be published as official information. And finally, we see the indicators that have to do with the satisfied demand, with the effective demand. So these are the people who are effectively receiving some sort of care service, either from the government, from the households, and here we make a lot of use of the time use survey, and from the private sector, and also from the community. And here again, we only have one indicator, and it's an indicator that is collected by us, by the Statistics Bureau. So let me show you some examples on how and what this data shows. For example, if we go to this indicator that has to do with the quantity of no, let me show you. Sorry, I got confused. Let me show you this one. Oh, sorry. No, this is not. Just a second. Let me show you this one. That has with the graph already. This shows you the quantity of services, the units that provide care for children of age between 0 and 3 years old, what we call the initial level in Spanish, and it is organized, the information by geographical area, as I mentioned. And as you can see here, I'm not so sure if you can see this as well as I'm watching that in my screen. For every year, there is a huge difference between the services provided by the public sector, the sector estatal, and the services provided by the private sector in the southern part of the city of Buenos Aires, which is the poorest part of the country, of the city. You see here, we have a very short bar, and here we have a very large bar. So here you see a difference in who is providing the care service, with a stronger presence of the government in the southern part. If we go to the indicator and press here, I'm sorry, the internet is not so good. Here it is. We see this in a table. And here is one of the good features of this portal, that all the data is reusable. Considering the first or the second slide that my colleague from data organization was showing, all this data can be downloadable, as you see here, and reused by anyone who wants it. And here, the other thing that this chart is showing us is that the whole number of facilities has not grown significantly from 2006 to 2020. So here there is a message for public policymakers on where to invest. If we go up to this part of the indicators of context and see where do people with of young ages live in this year, you see, we go here to households with presence of children. It's taking some time. We press in this part of the portal to see the information by geographic area, by zona. We will see that in the southern part, there is the majority of people, of households with children of a young age, from 0 to 5. So here we have, with this portal, another policy message, that is, there is a correspondence between where the government is investing and where those families, these households with young people living. So these are some examples that to show you how this could be useful. But here are the...
We are on time, Marisa.
Sorry, it took more time than I thought, because I really enjoy like showing and using what we are seeing. I said that I have like a couple of questions to answer. I talk about how did we build the system partially, and how we expect to be used. And the truth is that as Shaida and Megan were mentioning, sometimes we produce a lot of data, but if data is not used, is not consumed, then I think that the whole investment has not been worth. And the truth is that we want this portal to be used more. And for that, I think that we have a couple of things to do. First is to disseminate. This is why I took a lot of time like showing and going around, because we want everybody to know how the beauty that this has, all the information that it has, but also to educate on how to use it. Because sometimes all these conversations are among people who have some sort of knowledge, and I guess that it's not so difficult, but we have to make time within our agendas to go and show it and to explain it and to convince policymakers that before making any new law, making any new project, there is data there that could help them a lot to guide their decisions.
Thank you, Marisa. This is really inspiring project for all the world, because I think that it's unique, and hopefully next year when we will meet again in this event, we have more local government showing information about how care is distributed in cities. So we have around I think that 10 minutes until we have to wrap up. I have a question here for all of you, but I want to invite all the participants that are watching the session in the website, that if you want to ask something or to share your ideas or experience with the panelists, please go ahead. I have one questions, and if you Marisa, Shaida, or Megan have question, of course, let us know. But my question is about the thing that we mentioned in all of the presentation. I think, how can we bridge the gap between the process of publishing information and actually seeing an impact on transforming gender relations? I think that all of you trying to talk about that, but we have 7 minutes. So I want to know, what do you think about that? How we can bridge that gap in publishing data and using data to have really change in the gender relations. So I don't know, anyone wanted to jump in to address this?
I'd be happy to take couple of quick points on how do we bridge that gap. I mean, that gap is quite a lot, you know, part of it, and the causes of that gap, part of it is because of the data literacy in many countries is low. So even if people have demand for data, but they really don't know how to use that data. So building data literacy is tremendously important. The other one is to bridge that gap is really what we were just talking about in many of our presentations, that the data producers and the people who are governing data have a responsibility to make that data accessible and usable. And also people, researchers and users, and high-profile users like Megan from CGD, to speak up about the importance of data and that countries and agencies need to invest in data. So that feedback loop from the users to producers is tremendously important. The final thing is that we have to wake up our politicians. They need to invest in evidence, in data, and not only just invest in it, but show, be a sort of a champion and show the way for using the data for evidence-based policy and decision making. So politicians have a very big, and parliamentarians and decision makers have a big role in breaking this, bridging this gap between data production and use and impact. Thank you.
I would just very much echo Shada's last point, and in doing so, applaud Marisa and team, because I think your ideal world is one in which a team sitting within a local or national government says, we're going to take this upon ourselves, right? To create this tool, to populate it, to go out and do these surveys, survey your own administrative databases to populate it, and then use it to inform your decision-making looking forward. We don't live in that world in most national and subnational contexts, right? Especially on this issue of care. I mean, you are so far ahead of your counterparts. And so that's where I think in bridging the gap, we need to look to think tanks, we need to look to advocacy organizations, especially those who are rooted in local contexts and are able to push their governments in the direction that Marisa and team have already jumped on. So it's harnessing the data that's out there and examples like the portal, and pushing and making it clear that there is sort of outside will and demand from citizens for this data to be collected and used and published.
Well, I cannot add more because they have said almost everything, and repeat part of my presentation also. And thank you very much, Megan, for your kind words. Still, I believe that it's not so easy. Sometimes you have everything, but then there are other obstacles that come across, and there are always, as you mentioned, when you compare the amount of money that the World Bank or the donors in general were investing on childcare relative to oil and gas, and still these other decisions are sometimes not very well prioritized, even if the data is showing that that is worth investing on that. So I guess that what we have, another way to bridge that gap is to make these coalitions of like reformist actors stronger, and try to work all together and with all our resources towards the same aim. Sometimes in our own game of like competing about who is doing this more fancy or better, we do not cooperate, and these are missed opportunities to really promote the change.
Thank you, Marisa. Thank you, Shada, and thank you, Megan. I think that work collectively is the answer. Of course, it's to challenges and difficult to work on it, and to try to work with open data when we have a lot of problems to solve. But I think that the inequalities in the gender inequalities is something that governments need to solve now, with information and with the collaboration with bilateral organizations, international institutions, with the advocacy of the civil society organizations, with the work with the community organization that work too close with the women that suffer this type of problems. So I don't know if you have more questions in the chat. I think we don't have any questions, but I don't know if Marisa or Megan or Shada want to share with us super wide highlight of possible solutions to try and address the gender pay equity in the care economy. We have 1 minute left. Sorry. Can you share one sentence to close the session, and then I will close it.
My one sentence would be that we really need to invest in building foundational data systems in countries, and focus really on countries, building foundational data systems, which includes civil registration system, vital statistics, census, surveys, and really build a sort of look at the full system approach rather than try to pick and choose and do piecemeal approach. For gender equality, we need really a quality foundational data system.
I'd say that relates to the donor financing side that I presented on earlier. We need improved kind of transparency and clarity around what is being financed and what impact it's having. And at national and subnational level, I am now encouraged to make sure that Marissa, the portal, is a model for other country and city governments, because I do think the mapping of the market and an understanding of the baseline is where we need to proceed from.
Well, I think that we are out of time, but as a producer of data, I think that our responsibility is to disseminate it and to educate and to convince that this data is the new oil for policymaking.
Thank you so much for this interesting and inspiring discussions. I'm very excited to continue this conversation in social networks, on in a meeting and in a coffee. Thank you so much for RightsCon for hosting this for us. Hopefully, all the participants that are watching this session be able to access to the recording and the slide deck through the website itself. Also, Marissa and Megan share in the chat the links of the project and the project and record that they shared during the session. Thank you so much, Shaida, Marissa, and Megan. It was a pleasure to hear of you, and hope everyone have a nice afternoon, night, or morning. I don't know. Thank you so much.
Thank you. Thank you.
Bye-bye.
Thank you, Mercedes. Bye, everyone.
Bye.